I've been tested for Lyme, and I was told the test came back negative.
Yes.
Assumed I don't have Lyme.
Sure.
But I feel like I do.
Right.
I'm not really sure.
Oh, this happens a lot. So this is a kind of a different argument in how the testing criteria is interpreted. So standard CDC criteria is they run what's called an ELISA test, and then if that's positive, they do a blot test, either a Western blot or an immunoblot. And then on the blot test, it's matching bands. I tell people the coolest part about this is they glow kind of neon, which for a nerdy scientist in college was like, ooh, we're in a lab and something glows. So this is kind of a fun test to run, because I literally remember running these things in college. But you're trying to match, 5 out of 10 have to match for you to get diagnosed with Lyme. Now the CDC says directly on their website, this is really not to be used for a clinical diagnosis. It's not really designed for doctors to use it as the criteria. And in fact, IDSA, which is one of the societies for Lyme, has completely different criteria, which is much more based on the clinical presentation of a patient. So between the CDC and IDSA, we have actually pretty different criteria, published criteria, on exactly how to diagnose Lyme. So welcome to some of the controversy between some of the biggest organizations here. But most people will follow CDC criteria. And there are some big problems with this. This is really set up for epidemiological surveying, not for the clinical diagnosis. It's set way on the side for if it's positive, it's absolutely positive, but we're going to have a ton of false negatives. We are not going to have almost any false positives on the CDC criteria. We're going to have a ton of false negatives. So we have a lot of patients who go, yeah, I got tested and they said it was negative. Now, what we do is a couple things, and I really like what Dr. Richard Horowitz says. He's got some great Lyme published books and published materials, is if I just run the blot. I don't like to do the first test and the second test. I like to just run the blot. And there are some bands that I say are very promiscuous. So for example, band 41 will test positive a lot, okay? But other bands are extremely specific to Lyme. And he looks at it and says, if any of the specific Lyme bands, like band 23, 83, 93, and a few others, he goes, are very specific. If you have the clinical presentation and you're matching some of those bands, he's going to make the clinical diagnosis of Lyme. So what we do in the office is a mixture of making sure you get some more thorough testing than just the initial screener test. A lot of people get that initial screener test. You want to try to get the blot, and then you have to realize that there is some wiggle room in the interpretation of that blot, particularly when you have a lot of the symptoms as well.